Hello, everyone. Today we'll be discussing major depression. The reason we chose to discuss this topic is because major depression is one of the most common mental disorders in the United States. Individuals suffering from major depressive disorder, MDD, may experience severe impairments in their ability to carry out major life activities. And these are things such as keeping a job, being a parent, or even being a spouse. We'll be discussing the effects and causes, who is susceptible to depression, the different subtypes of depression, treatment options, and then we will conclude. This condition affects about 20% of women and 12% of men. Depression affects everyday life, from things like working, studying, eating, and sleeping. The individual in this picture suffers from depression, and it looks as though he is having a difficult time studying and likely has a poor appetite, as there is a plate full of food in front of him that has not been touched. And these are some of the struggles that people suffering from depression have to deal with. The causes can be a combination of things: biological, specifically genetics, psychological, and social sources of distress. If you have a history of depression in your family, especially in your immediate family, you can be 3 times more likely to have depression yourself. The physiology behind clinical depression focuses on 3 neurotransmitters for depression. These are serotonin, norepinephrine, and dopamine. Francisco will be discussing these neurotransmitters with you in more detail.
Our brains consist of billions of nerve cells that communicate through chemical messengers called neurotransmitters. When a neuron is activated, an electrical current is produced and travels down the axon to the nerve terminal. Here, the neurotransmitters are released into the synaptic cleft, which is a space between the 2 neurons, which is the slide that we're looking at. The message is then passed to the next neuron and produces the effect that neuron produces. So for dopamine, it will be pleasure. For serotonin, it could be happiness. And for norepinephrine, it could be like an increase of energy. These 3 neurotransmitters have been linked to the cause of depression. When our bodies produce low levels of these neurotransmitters, our chances of experiencing symptoms of depression increase. Some symptoms produced by these neurotransmitters are improved energy, improved attentiveness, and anxiety for norepinephrine, boost in mood, satisfaction, and happiness for serotonin, and increased attentiveness, motivation, and pleasure for dopamine. The monoamine deficiency theory is an idea that is suggested or presented as possibly true, but that is not known. This theory suggested that the cause of depression was due to low levels of serotonin, norepinephrine, and dopamine. But why are these 3 neurotransmitters low in the first place? The real reason is unknown, but a variety of predictions have linked some causes to lack of sleep, chronic stress, poor diet, anxiety, and a host of other factors. But the real reason is still unknown, so research remains ongoing.
So, diagnosis of major depressive disorder involves the client meeting criteria outlined in the DSM-5. In order to accurately diagnose a client with major depressive disorder and describe the features of the condition, the client must meet 5 of these 9 criteria at least. Major depressive disorder with catatonic features will generally meet criteria for psychomotor involvement, whereas a client suffering from major depressive disorder with melancholic features will meet criteria for the loss of pleasure. Postpartum depression is defined as a major depressive disorder that occurs during or immediately after delivery of a child within 4 weeks. This form of depressive disorder may onset during pregnancy or following delivery and may persist on a case-by-case basis. A typical depression exhibits features that may improve or worsen based on events or happenings within the immediate proximity of the client. Melancholic depression, diagnosis of this subtype of depressive disorder requires the client to either exhibit signs and symptoms of anhedonia or a lack of mood reactivity. Anhedonia is experienced when a person finds themselves unable to experience joy or find pleasure in all activities that previously brought them pleasure or elevated their mood. Dysthymic disorder is a form of depression that is categorized as chronic and persistent. In order for any depressive disorder to be characterized as chronic, it must persist for at least 2 years, and this severe form of depression does not usually present with psychotic symptoms, but may feature catatonic and or melancholic symptoms.
For the treatment options for depressions, we have 2 categories. The non-pharmacological approach, which includes the psychotherapy, cognitive behavioral therapy, somatic and electroconvulsive therapy. For the pharmacological approach, we have the use of medications, the antidepressant medications such as SSRI, TCAs, and MAOs. Although options can vary depending on level of severity, with the right treatment, 70 to 80% of patients can significantly reduce their symptoms. One of the non-pharmacological methods is the physical activity. This releases the endorphins, raises the body temperature, and relaxes the tense muscles. A data suggests that a 20-minute exercise 3 times a week could alleviate the symptoms of depression. We have the N-Shape on Pershing Avenue and one in Hammer Lane. We also have the Planet Fitness in March Lane and Hammer Lane. For address and information and numbers, please use the Google search. There is a research that explores the relationship between the diet and depression. Although there are no silver bullet foods, experts suggest eating more fruits and vegetables, along with exercise in general, is extremely beneficial for a number of reasons. Another non-pharmacological approach is the psychotherapy, or also known as the talk therapy. This is kind of treatment which is preferred for younger patients and those who are experiencing mild symptoms. There are 2 types of psychotherapy, the cognitive behavioral therapy and the interpersonal therapy. These methods needs a good relationship between patient and therapist, as well as the clinical skills of the therapist.
Moving on into the medications. Typically, medications are the primary source of treatment, but only started when the patient starts showing mild to severe symptoms of depression, and they've been battling for it for long periods of time. Most common types you'll see are the SSRIs, the selective serotonin reuptake inhibitors. Basically meaning that these medications help the body keep that serotonin that the body's trying to get rid of, so that way it kind of benefits the patient and increasing their mood and just their overall sense of well-being. Typical other ones you'll see are the MAOIs or the tricyclic antidepressants. So here we have a visual aid just helping you see how the SSRIs are actually in fact working. You see that the SSRIs produce that effect of the serotonin coming back up into the cell. So if our medications prove to be ineffective, we also have electroconvulsive therapy. This is typically only used for those dealing with severe major depression. It's typically the last resort treatment. With that being said, they have to have a series of tests to make sure they're medically cleared and done by multiple physicians, not only just one. They'll be having EKGs, CTs of the head, chest x-rays, and just basic physicals to make sure they're stable and sound. So with the use of ECTs, basically the way it works is a small amount of electrical current is passed through the brain. The patient is under anesthesia, so they don't feel any of this at all, but we are inducing a small brief seizure. Typically the whole process is about 2 to 3 minutes, and the patient wakes up within 5 to 10. Proving to be effective for about 80 to 85% of patients, so that is great numbers. although the reason as to exactly why it's improving is still yet to be 100% understood.
Clinical depression is tough for those who are suffering from it, as well as for the healthcare professionals who are trying to treat it. Depression also carries a social stigma, which can make the person feel worse and even prevent them from seeking treatment in the first place. As a family member, as a friend, or even just as a member of our community, we can show love and support to those who we know that may be suffering from depression. It has been proven that having a strong social support network leads to better outcomes.